There we go. Being weird. Anyhow, hi again, guys. I decided to do this from my laptop this time. Um, I don't know. For some reason, the last one I did, my mic on my headphones went all crazy, and yeah, it was horrible. So, I thought, well, I'll give this a try. So, to continue everything, where was I? Yes, right. Last 2 years have been horrible. In 2011, it was May, June, I had this attack, and it was right on, not my temple, but behind it, right in here in my head. This severe pain, headache thing. Every time I bent over, it just literally felt like my eye was going to fall out. It was absolutely horrible. They thought it was, I can't remember the exact name of it, but it's a disorder where the vessel swells up and stuff. So they finally sent me to a rheumatologist for this, but they also put me on very high doses of prednisone. Prednisone is a very evil drug. Those who have been on it know this. I swole up like a balloon. I gained 30 pounds. And I've always been borderline diabetic, and that just pushed me over the edge. The prednisone pushed me over, and had to be on medication for my diabetes for a while as well. And so, prednisone I don't recommend to anybody unless you absolutely have to take it. It's really nasty. So this went on for quite a while. Actually went on for months and months, and never did really figure out why or what caused it. I still get it on occasion, but I mean, it's nothing like it was, that's for sure. So he started doing some tests on me, and he was the one that came to the conclusion that my condition is an autoimmune disease, yet to be identified, because he can't quite put his finger on it, I guess. Either that or he doesn't want to give me a diagnosis. I don't know. But point being is my ANA is positive. My rheumatoid factor is also positive. Now I don't know all the tests he's done on me. I can't remember, so I have to ask him again when I see him next month. But I know those are the two that I've had done that are positive. And I know all the other ones that he has run have been negative. Now, from everything that I've researched, it doesn't necessarily mean anything when it comes to lupus. I mean, you can have everything negative and not even the rash and everything else and still have it. So it's a very hard disease to diagnose. And because there's no definitive test that says, yes, this is what it is, it's lupus. It goes based on many, many things, not just blood work. Symptoms as well as combined blood work, and sometimes, like I say, blood work doesn't even show up. There's lots of people that have lupus that have a negative ANA. And there is one test, however, that I did research that may probably be the biggest factor for lupus, as I think it was 60 to 80% of the people that have it have this particular thing. Oh, sorry, pop-ups on my screen. Yeah, I gotta love it. So, but I'll go into tests and stuff in another video. So, what happened then? Then I ended up getting, I was bleeding a lot. Like, I had to go every week for a test for my rheumatologist to check the levels of inflammation in my system. And I noticed, like, I've always been taking a while to stop bleeding when I get blood work, but it was getting worse. And this one day it was horrible. I had my blood work done. Oh, it's the ESR test, that's it. and I was leaving, and I sat there for the normal length of time, put a Band-Aid on me, started leaving, and blood was literally dripping. So I was like, run back in. So they said to me, no, Kelly, you better go to your doctor, get this checked out. So I did, and it turned out my PPT levels were abnormal, which is an indication of a bleeding disorder. So I have seen, don't mind that noise, that's my cat litter box. So I did see a hematologist, and he has done a battery of tests, and so far all have come back negative. So I have read in places that lupus can affect your PPT levels. So again, who knows? Then I ended up getting anemic. Now, I didn't realize I was anemic because the symptoms of anemia are so similar, unfortunately, to the symptoms of the autoimmune disease. Being tired all the time, just general fatigue and feeling unwell. So because the symptoms of anemia are so close, I didn't even realize it, and it was actually blood work that pointed that out. So I had to battle that for a while. And from what I understand too with lupus is that you can get anemia. So that's another thing to watch for. And then about 2 months ago, I started getting the rash, the facial rash, the malar rash. Now, whether it's actually a malar rash, I don't know yet. I have mentioned it to my rheumatologist, but it happens after I have a shower, and not immediately after. Like at first I thought it was the heat of the shower, but it's generally about 10-15 minutes after I have a shower. Then it gets really red in here and across the nose, the typical. Sometimes it's a mottled looking, and I actually took a video on my phone of today when I had a shower to give you guys a look, and I'll see if I can somehow get that on here. But generally it can be quite fairly pale. Other times it's very bright. Sometimes it's mottled throughout my cheek. Other times it's just bright in this area. So it varies. But that just started a couple months ago. And I never had that before that I know of. So that's the things that I've been going through. Now, I'd like to do a series. That's my cat. That's Sylvanus. Yeah, hi Silly. And I'd like to do a few different videos on various topics, medications, at least what I'm on, what I've been on, what helps, which is pretty much nothing, unfortunately, and so forth, as well as relaxation techniques, meditation, because I really do think they do help, as well as how much I feel stress and so forth plays a factor in this, in flare-ups especially, and also some genetic things, because I found it quite interesting when I started researching what I could research from my family tree as to different things and conditions that have happened through time from my family. So those are my set of symptoms, and as I blog on, so to speak, basically I'll just let you know what's happening with me, seeing the doctor, this happened, or having a flare-up, this happened, just to kind of give you an idea of what you may be up against yourself, because obviously if you're watching this, you might have it. Oh, yeah, fell asleep on me now. So yeah, that's about it for now. I'll see how this turns out. If this turns out better, then I might just use my laptop from now on, as long as it doesn't keep cutting me off like it has twice already. So you guys have a great day. I'm going to try and get out in beautiful sunshine, because yes, it's finally sunny here in Vancouver. Been raining a lot, So I'm going to go out on my scooter and go along the trail and enjoy the day. See you later, guys.